we look at this, the one kind of common thread you're going to hear throughout this is that ADHD is what we call an invisible disorder, in that it's hard to identify kind of what is being impacted by a student's ADHD and what kinds of things can it cause, because a lot of these things are things that maybe we don't recognize or see right away. So the things that we notice, the fidgeting, the getting out of the seat, the trouble focusing, the calling out, those are some of the things that we can see, but a lot of these things happen under the surface. And for those of you, we'll share later on a copy of this presentation, so don't feel like you have to furiously take notes or anything like that. It'll be available for you. And so these are a lot of things that they'll see. And then we'll also talk a little bit about what we call comorbidity, and how students who struggle with ADHD often struggle with other challenges as well. So real briefly, we'll touch on kind of what are some of the common treatments and supports that kids with ADHD are provided. The first one, and the most common one people are aware of, is the pharmacological treatments. These are medications that are prescribed by a doctor to help children with managing their symptoms for ADHD. There's also cognitive behavioral therapy, which is working with a therapist to build skills, recognize kind of what areas they struggle in and what kind of support can be provided and what kinds of strategies they can use to manage their symptoms. It's not common for folks who are older who have ADHD to get life skills coaching, to work with a life coach to talk again about kind of how does my symptoms impact me throughout the day and what kinds of things can I do throughout my daily routine to try to mitigate those symptoms. We have school-based behavioral interventions and accommodations. And then the last one we have is treatment of comorbidities. And we'll talk about what some comorbidities are in just a second. But oftentimes ADHD can come in tandem with something else. And so we try to treat the something else to alleviate some of the ADHD symptoms. So a question just to think about: the most common drugs for treatment of ADHD are stimulants. Why do we give stimulants to children who may be experiencing severe hyperactivity? So take a second, think about it. So think about your student who is running up and down the hallways all day, every day. Why would the treatment that we give them be a stimulant? So we're going to answer that question. But first, a little quiz. So on the left, you're going to see a pair of brains. And on the right, you'll see a pair of brains. In the areas where the brain is red, those are areas of higher activity, higher brain activity. And on the areas that the brain is blue, green, or purple are areas of lower brain activity. So I want you to take a second. Between 1 and 2, one of these brains is from one of these MRIs is from a person with ADHD, and between 3 and 4, one of these brains is an MRI of a person with ADHD. So feel free to drop in the chat which one of them, which 2 of these brains do you think are brains of someone who has ADHD? All right. So I'm seeing some consensus around the board of brain number 1 and brain number 3 are brains of folks who have ADHD. So in reality, brain number 2 and brain number 4 are students who have ADHD. So why is it that somebody who is appearing hyperactive with extra energy, their brain is actually showing less activity than someone who we would say is neurotypical? Well, there's a lot of theories about why that is the case. And one of the kind of prevalent theories is what we call the low arousal theory. And people who have ADHD can not necessarily explain this theory to you, but they can explain how it works pretty well. So people with ADHD, the theory is that they have chronically understimulated brains. And so their brains are constantly seeking out stimulation. What we do know about people with ADHD is they have difficulty regulating their dopamine levels. And so they are actively seeking out things that their brain finds rewarding, ranging from hobbies that they're passionate about, things that might be unproductive, unhelpful, or even things that are dangerous. So sprinting down the hallway while it's unproductive and dangerous gets a student's dopamine levels pumping. So that's one of the things that people with ADHD will do, is they'll often seek out ways to kind of get dopamine boosts. And surprisingly enough, everybody does this. We may not realize it right away, but this is something that everyone does. And so I put a little quote in here from a parent, or from a meeting I was in a long time ago, where we talked about a student who we knew had ADHD, and how he could not sit for 5 minutes during math class, but when he went home, he played Xbox for 4 hours without moving or blinking. So something to think about. So I talked about this word dopamine. And what is dopamine? Dopamine is a neurotransmitter, and we call it the feel-good neurotransmitter. Every time you do something that feels good to you, your body gives you a little rush of dopamine. So for example, if you are eating fast food before you get home, if you're getting likes on your Instagram account, you just ordered your 12th package off Amazon and they've told you that it's arrived. If you're having a day where you're actually being productive during your planning time, you're playing video games, you are out for a jog, you're doing anything that you love, you get a good feeling. And that feeling is dopamine coursing through your veins. And so the medication that is used to treat ADHD, what it does is it helps raise or regulate someone's dopamine levels. So that what it does is it kind of gets their body to a point where they feel appropriately stimulated. And so they can start to function better and work on things that they're supposed to be doing, or that they may need some extra support to do. One of the challenges with ADHD, and a lot of students that I've worked with in the past who have ADHD, is that it can have some negative impacts. And one of them is creating this negative feedback loop. A lot of kids who have ADHD will tell you that they know that something is different about them. They can't explain to you what it is, but they know that something is different. They look around and they see kids that don't struggle with the things that they struggle with. Oftentimes they can't put it into words, and therefore it just kind of collects, and they start to associate these behaviors with just who they are as a person. So these are some of the things that I've heard from students who have ADHD, is they'll say that, you know, the other kids don't act the way that I do. They'll say that something is wrong with me. I've had kids who will scream that they can't control their body even though they want to. They'll say things like, I'm stupid, I'm worthless, I'm lazy, so why even bother trying? Why bother trying to manage my behavior, because no matter what I do, it doesn't work. So this must just be who I am. And so therefore, there's no point in fighting it anymore. We also wanted to touch base on what we call comorbidities. And this is something really important to consider when you're working with a student who might have ADHD, is at least 50% of people with ADHD also have one of these following. And it can show up in different ways. So they might be suffering from depression, anxiety. They might have learning difficulties. They could have language impairments. They could have fine and gross motor difficulties, executive functioning difficulties. So like things like working memory. And then lastly, they could have, you know, things like tic disorders. So physical tics, oral tics, Tourette's, etc. So, and oftentimes these things will work kind of in a negative feedback loop with each other. So, for example, kids with ADHD can be very sensitive about how others perceive them. They know that something is off. They know that something is different about them, and that can create high levels of anxiety. And in turn, it causes them to have struggles with focusing even more. And so these two morbidities can often kind of play off of each other and create really some disastrous outcomes. Now, this feedback loop, it stays with them. So kids don't just graduate from high school and they're all good. You graduated, you made it, your ADHD no longer impacts you because you graduated. What happens is oftentimes people with ADHD can experience some of these things. Poor work performance, unemployment, trouble with the law, substance use, unstable relationships, poor self-image, poor physical health, poor mental health. So what we do with kids now is so critical because they are at a higher risk for some of these things here. And so that's why we put so much time and effort into supporting them as best we can. So I am a student, or I was a student with ADHD. Now I'm just a guy with ADHD. And so I was going to share a little bit about my experience. Up here, I have a little bit about some of the things that I heard often when I was in school. That I was easily distracted, that I was very smart, but I was very lazy. My sister's in the audience. I hear her I see her nodding. I can't stay focused on one thing, that I'm always bouncing around. The common refrain from year to year, from kindergarten to 12th grade, was he would do great if he just applied himself. And we'll come back to that one. I can tell you that I always felt kind of disconnected from the world around me. There were times where that disconnect would feel like a few minutes and times where it would feel like a few hours. Like if you've ever had that moment where you're like driving to work and you're on autopilot and then you like suddenly come to and you're like, oh my gosh, how did I get here? Like, I don't even remember driving to work, but here I am. Imagine that for several hours of your day or several days even. And so for me, I wasn't diagnosed until I was 24. And I've kind of participated in a lot of different types of treatments. So that's included cognitive behavioral therapy, that's included medication, and that's included life and work coaching as well. Now, I share all this to tell you something about the students that you're working with, is that living with ADHD as an adult every day, some days you feel great. Some days you hardly notice that certain things are more difficult for you. Other days, it is pretty terrible. I'm 32. I have a master's degree in special ed. I get consistent support for my ADHD, and I can manage my symptoms on a great day about like 60% of the time. So now, imagine you're 7 and you're in a classroom of 25 kids. How difficult that must be for those kids. So I'll explain the creepy picture. So these are things that I struggle with every day. Distractibility. My wife will tell you that my memory is the best and worst that she's ever seen, because I forget things that she told me yesterday. But I remember a offhand conversation about a movie reference from 4 years ago. I often feel a disconnect between what I want to do and the motivation to do it. So I have a long list of things that I would love to do, things I'm excited about. And when it comes time to do them, there is some just disconnect that I have trouble making that first step sometimes. One of the things we'll talk about is how the environment the environment that students are in plays a factor. So I had to go to a meeting a few months ago for special ed, and it was at the transportation office. And in the back of the meeting room is this creepy doll that they have sitting in the back, just like, I forget what it was there for, something with, something with transportation or whatnot. And so even as an adult, I'm sitting here trying to focus on this very important meeting that had lots of important information. And then you have Annabelle in the back staring at you. That makes it really difficult. So again, imagine things for our kids who are still kind of learning how their brain works. And it's really tough. So, as you think about your questions, if you have questions for me, you cannot insult me or embarrass me with your questions. Feel comfortable to ask away, because one of the best ways to support your students with ADHD is to learn about what ADHD is. And a lot of kids, even our older kids, don't have the language to explain what it's like for them. So working with adults who have ADHD, who kind of swim in this soup every day, are a good bet to kind of talk through what some things are that maybe you haven't considered or needing to generate some ideas. And that's why a big reason for this training. So I have a few big takeaways, and here's the first one, is that students with ADHD are working with a brain that they don't understand, that often does not cooperate in an environment that was not built for them. So if you remember anything from this training, is that I did not want you to leave thinking that students with ADHD should be let off the hook for their behavior. They do not need less accountability. In fact, they need more accountability. I, as an adult with ADHD, do not need less accountability because I have these struggles. I need more accountability. I need more support, and I need more systems and structure to help me do what I want to do, and not just what other people want me to do. So when we meet a teacher that gets it, it means the world to us. So instead of telling students how good they can be, you want to show them first how great they already are. And then we can make room for growth. So if you want to know what it is to work with a student whose brain works differently, that you need to know this. Students need to know that it's okay to have a brain that works a little bit differently. Everyone's brain works a little bit differently. And students, most importantly, need to know that they are enough. And it's not that someday they will be enough. It is today they are enough as they are, with all of their strengths and weaknesses, perfections and imperfections. So students will not be willing and ready to work with you until they know that they are simply accepted as who they are in their current state. So getting into this sense of like, well, what do we do? We know all these things about students. We know what ADHD is. How do we go about interacting with kids and helping them grow? Because one thing I do know is that kids who have ADHD, a lot of their behaviors are in your face. Kids who are running out the door are going to be sure to get a lot of attention because you can't have kids running around the building. So one thing I want you to keep in mind, here's going to be our next takeaway coming up, is when kids make mistakes, they are still learning kind of what do they do with those mistakes. I know for me, when I was in college, I forgot to show up for a final exam. I studied very hard for it, and I full on forgot about it. And so that was a big mistake that I internalized. And I thought, wow, like, how terrible am I? How ridiculous, how stupid am I that this big important thing happened and I totally blanked on showing up at the right time. And so kids will take mistakes and they'll attach them to their essence, kind of the person that they are. I did something wrong, so there is something wrong with me. And we don't just do it to ourselves, adults do it to us. When we have a hard time really kind of explaining to kids what we need them to do, because we understand that they have to be able to sit in class and they have to be able to engage in activities and conversations, and there are behaviors that are safe and behaviors that are unsafe, and we need them to understand that. So one thing that's most important when you're talking with kids about disabilities, and really any kid, doesn't matter if they're a student with ADHD or a student with a disability or not, our mistakes are our mistakes, and they're not the result of a moral failing, but the result of a bad strategy. I didn't miss my final exam because I'm lazy or stupid or a bad person. I missed my final exam because I didn't have a good enough system to remind me of when I needed to be there. It wasn't a moral failing, it was a bad strategy. So, and also kids need to know that their successes, the things that they do well, are not just luck, not just sheer luck. They didn't have a great day today just because, but often it's the result of good strategies. So all the exams that I did make it to and did great on were the result of studying, setting reminders, and doing all the things that I should have done. So when you're critiquing students for their behavior, you want to critique their strategy and not their essence. And we'll give you some examples. This is an example I think a lot of folks can relate to. This is two adults talking, and one says to the other, "I told you about the dinner plans with the Millers a month ago. You forgot because you never pay attention when I talk to you. You never listen to me, and now I have to call and cancel because of you. Why do I even bother? It's like you don't even care what I have to say." So in this situation, there's a clear mistake. Somebody fell short on remembering something important. But the feedback is over the essence. It's you don't care. And in my head, if I heard that, I'm thinking, wow, I must not care. But I do, but I guess I don't because I forgot this important thing. And so instead, we have to look at how we can critique strategies over essence. So I want you to take a look at these three things. These are three things that I have heard teachers say verbatim to students. And I want you to think about how could we critique strategy over essence. And remember, it's not just about when things have gone wrong, it's about when things are going right too. So how can we critique strategy over essence? So just take a moment and think about it. So I really like the first one because this is something that on the surface, if somebody told you this, you'd probably feel really good. And you think, wow, I must be smart. I passed, I got an A on this math test. I'm smart. And then your next math test comes and you get a C. And you think, well, I guess I'm not smart because I didn't get an A. Instead, what you could say is, I noticed that you studied really hard. You put in extra time, you put in extra practice, and that caused you to get an A. And that is awesome. And that's something that we're going to celebrate. So if you notice, it critiques my strategy. My strategy was putting in extra study time or putting in just extra effort. It's not a statement on who I am as a person. On the flip side, you could say, well, you got an F on your math test. I noticed I didn't see you doing any studying. We had study sessions and you didn't show up for them. What could you do differently? What could your strategy be next time to help you get some improvement? And you can say, until you come up with a strategy, I'm going to provide a strategy for you. This is the strategy we're going to do. If you have other ideas, I'm open to it, but this is the strategy we're going to use moving forward. When I look at the third one, I know all of you never have students who shout your name to get your attention. I'm sure that never happens, but just in case it does, one thing you could think about is very quickly deciding for yourself, well, why is this student shouting my name? So if they're trying to get your attention, you can talk with them and say, you're trying to get my attention. It's not a good, trying to shout my name to get my attention. It is not a good strategy to use. It is not going to help me pay attention to you faster. What's a better strategy is I need you to raise your hand. I need you to wait until we have a break. So teaching them the right way to do something. Because when I hear this, you're a disruption. Well, you're just kind of, you're not giving me any helpful information. You're just saying that I'm bothering you and that I'm annoying. So you want to think through, how can we critique strategy and provide support with strategy over essence? So takeaway 2, critique strategies, not essence. And this can be even for more difficult things. If you have a student who's running out of the classroom, well, when I have students who are running out of the classroom, 9 times out of 10, it's because they want someone to chase them. They want someone to come after them. So they are seeking attention, and they have a very, very poor strategy for doing so. And again, I levy with them the seriousness of running out of the classroom or running out of the building, but the feedback is always for the strategy. If you want my attention, if you want me to work with you one-on-one, this is what I need you to do. Running out of the classroom is not a good strategy for getting my attention, because you're going to get my attention to collect you and bring you back in, but after that, I'm going to have you sit. And I'm going to be working with the kids who I had to miss because I was chasing after you. So a few kind of little quick things about, well, what do we do? What do we do with some of this information? One thing that's really important that I always clarify during this training is a reminder that we're not doctors. So ADHD is a medical diagnosis. A lot of teachers will ask me, like, how do I talk with parents about diagnoses or medications or things like that? I always encourage them to kind of steer clear of those conversations, because I've had parents who've gotten very upset when the words ADHD are mentioned. But I also think that encouraging parents to utilize all their resources is a good thing. So I've definitely encouraged parents to talk to their child's doctor, to talk with their pediatrician. We've connected them with outside resources. The Family Resource Center is probably another great resource for them to talk to. But in terms of talking about, when I hear teachers say like, "Oh, that kid definitely has ADHD," I'm never sure how to take that, and it feels like a very quick judgment, kind of based on some observations, and maybe they're right, maybe they're wrong. But I really kind of just focus again. I focus on strategies and not essence. What are their strengths and what are their weaknesses? And what are things that they need some extra support in? Another one is talk with folks in your life who have ADHD. Statistically, you probably know one. You might be one. Talk with those folks and see if they're open and willing to share with you about what some of their experiences have been. The last two are critically important. The first one is create opportunities for success and build positive momentum. Momentum is probably the number one game changer for improving behavior that I've used in the past. Kids who do not know success will never desire success. So if you give them goals and incentives that they can never reach, or that they never seem to reach, then why on earth would they continue to try? And lastly, understand that there's no quick fix. Nothing in this game is ever a quick fix. So I always encourage teachers, if you're working with students who need some extra support, regardless of what it is, just make 5% changes. Find one little thing that you can change and make that change really good. And then find one new thing that you can change. The rest of the day can crash and burn in a spectacular fashion, but for that 5 minutes, we sat in our seat and did our math work. And take that victory and capitalize on it and say, you did this today, we're going to do it again tomorrow. Now, there's a huge long list of all kinds of things we can do in our classroom to help out kids who are struggling with ADHD and ADHD symptoms. I've highlighted a few. Number one is frequent scheduled breaks. I don't know anybody who functions well working without blinking for hours on end. And so scheduled breaks is an excellent thing that you can do. And you can do that for all your students. They don't have to be a student with a disability for you to say, let's take 2 minutes before we move on to our next activity. In elementary school, we say we get our wiggles out, we stand up, we stretch, we dance, and then we move on to the next thing. Another thing that's really critical that I found works really well is visual aids, not just your anchor charts that you use for your lessons or your PowerPoint slides, but visual reminders of things you want kids to remember. That could be if there's a particular behavior or expectation that you're working on. Maybe it's something that is simply taped to their desk. That's a constant reminder. A lot of kids with ADHD respond well to kind of visual cues, but asking them to remember something later, like, hey, when you get upset, remember to do A, B, C, and D, and we'll be okay, it's not a recipe for success. But giving them visual cues and reminders can be something that would go a long way. I like to provide different ways for kids to showcase their learning. So if if I know I have someone who's artistic, if we're doing a writing assignment, I might say, I want you to write, or I want you to draw a picture and then write about what you drew. Presenting it that way. If I have kids that love to talk, I'm going to give them the chance to verbally explain what they're doing or verbally share their answer before I ask them to write it out. That can help kids kind of organize their thoughts and not just give them opportunities for participation, but maybe drawing their thoughts out on paper just gives them more time to kind of collect them into a sensible answer. Lastly, graphic organizers, grid paper. I like to take like just plain white paper and split it up into 4 quadrants and have students do one problem in each quadrant, especially for math at the younger grades when their work can get kind of scribbly and sloppy and it's hard to follow. Just something like that, really simple, can help them kind of organize their stuff. These are all just kind of visual cues and visual aids to use. Some other best practices that we've used is a frequent check-in and check-out. Check-in, check-out does not mean just start of day and end of day. It could be before and after transition. Walking up to a student and saying, hey, in 2 minutes, we're going to line up for gym. I'm looking for you to show me what it looks like when we move in the hallway in a straight, quiet line. And then after you get to the gym, saying, you did an excellent job walking in the hallway. I saw you had your hands to your side, your voice was off, and you were keeping a safe distance between you and those around you. Could be the start and end of a lesson. If they're struggling academically, maybe giving them a cue that says, hey, today during math, here's what we're going to be working on. Here's what I'm looking for you to do. And then at the end of it saying, hey, it looks like you were having a little bit of trouble with this. Let's set some time to work on it. Or it looks like you did really good with this. We're going to keep doing it tomorrow, and we're excited to see you kind of continue to grow. And before, when you know that times are going to be challenging. For example, I had a student who was excellent all day except for when we got to math. Math was a struggle, and so that's when our challenging behaviors would come out. So I encourage you to kind of identify what those times might be and check in with them before. And then one thing I do is interactive modeling. I always try to teach at least one procedure during every lesson, no matter how small it is. It might just be, who can remind me how we use the pencil sharpener? Who can remind me how we stand up and walk to the door? Who can show it for us? Who can model it for us? And those kinds of frequent reminders of procedures are time investments of time that I get back later because I don't have to spend time redirecting it and repracticing 100 times over. Something important to think about is that when we, in special ed, we talk about ABC, the antecedent, the behavior, and the consequence. And we talk about behavior often in this linear fashion. Well, somebody called Johnny a mean name, so Johnny stood up and threw his chair, and the consequence was someone got hit with a chair. Oftentimes, behavior is not simply linear, but is many stimuli going in at the same time, leading to a behavior. A lot of kids who have ADHD can become overwhelmed if there's too much happening around them visually. I become overwhelmed if there's too much noise, or just kind of like things like the vacuum cleaner. I absolutely cannot stand. If I'm vacuuming, I don't mind it at all. But if someone else is vacuuming around me, I cannot stand the noise and I have to get up and leave. If you've got just like a lot of loud conversations in a small room, for whatever reason, ever since I was a kid, I just couldn't handle it. But I played in the drum line, and drums are very loud, so that never bothered me. But certain noises just really, I just found overwhelming to the point where I'd have to get up and leave. And so a lot of times that's what happens. So when we're asking kids kind of, well, what happened before? you stood up and threw a chair. They'll tell you the one thing that they remember, but in reality, it might be several things. It could be a low hum of an air conditioner that's just setting them on edge, and maybe they don't recognize it, but they feel it. And so it's important when you're having those significant behaviors to not just look at like what was the immediate behavior beforehand from the student, but what was happening around them. Were you in a quiet classroom or were you in a noisy room? Were you in the hallway during like a loud transition time, or was it just two people in the hallway was quiet? So what are some of those kinds of stimuli that were occurring beforehand? The bread and butter for supporting kids with ADHD is self-monitoring. Now, like I said before, the kids need a lot of support. And so we cannot expect on day one that kids will be able to monitor their own behavior. If that was true, it'd be wonderful. We'd all be in a really good spot. But we have to teach kids how to monitor and regulate their own behavior. And so here's how I do it. Here's the simplest way to think of it is I never start with like a whole day thing. I never say today you're going to spend your entire day in your seat. I know for the students I'm working with, it's just not realistic. So I'm going to identify just one behavior. Maybe it's shouting my name during class. I'm going to collect some data on when it happens and how often it happens. It's also, if you have extra staff around, you can ask someone like, hey, can you just sit in here for 10 minutes and count how many times Johnny gets out of his seat? And if it's 0, great. If it's 100, great. So from there, I pick a small chunk of time during the day, and I teach the student their replacement behavior. I don't wait until they're upset or frustrated to try and teach them a replacement behavior. I wait until there's a time where they're calm and maybe they're having a really good day. It's kind of like if you're really upset and someone tells you to just stop being upset, that will never in a million years make you feel better. But wait until they're in a good mood, they're having a good day so far, to try and teach a replacement behavior. So I pick kind of a small chunk of time. Maybe it's 5 minutes. We've done it where it's just like 3 minutes, and they just have to manage one specific behavior for 3 minutes. It could be 15 minutes. And what's the beauty of this is you can adjust and shrink and enlarge as needed. So if they're doing great with 45 minutes, we'll bump it up to an hour. If they're doing terrible with 10 minutes, we'll shrink it down to 5. We go through and we track our behavior. We track that one target behavior. So for this one, Jason is going to be in his seat during guided reading time. Guided reading is 10 minutes, and he's going to be in his seat, or 15 minutes, and he's going to be in that seat for those 15 minutes. And it's simply a pass or fail. You were in your seat, you were not in your seat. You were in your seat, you got up and left. And so from there, we've collected some data. We recognize that there's a pattern. Oh, right around 11:15 seems to be the time where Jason gets up out of his seat. So we know maybe there's something that we could do differently during that chunk of time to help encourage him. Maybe we just need to have like a small break in between, like a 10-second stretch break between 11:10 and 11:15. There's a lot of things that you can do with this. But this does not require kind of anything special. This could be done on the back of a napkin. It could be done on a Post-it note. Here's our goal for today. Raising our hand when we need help 3 times is what we're looking for. And if you go on, I have some samples that I'll share with you, but if you go online and just look up a sample behavior chart or self-monitoring chart, you will find more than you could ever use. So this is kind of the, again, this is the bread and butter of like how I try to work with students with ADHD to help monitor the behavior. And again, I only choose one behavior. And one day they'll get it and it'll be awesome, and the next day it might be a complete mess. But what's most important is to remember that we're playing an infinite game. We're playing a long game. And so people have good days and bad days just like the rest of us do. One thing that I found is that we really have to make it a point to uh, let victories be victories. And what I mean when I say that is if a student did really great on Tuesday, um, we can't say things like, well, why can't you do that every day? Nobody has ever heard that and felt better. It felt like they accomplished something. What I hear when I say that is, well, you're a screw up 4 days out of the week. And this one day you got it, but the other days are awful. So you kind of have to let every moment exist as its own little thing. You know, if you had a bad day and you got all X's, hey, you know what? We will try again tomorrow. Or you can say, do you want to try again now? You're having a rough moment, you got all these X's, and now you're at a time where you're calm and you're focused, you're in control. Let's do it now. Let's give you the chance to be successful. But when kids are successful, we have to say, hey, today you got all of your smiley faces, and that is worthy of celebration. We're going to do whatever reward you've picked out for them. We're going to call your mom or your dad and tell them that for this chunk of time, you did fantastic. You did the goal that we set out for you to do. And then we're going to do it again tomorrow. Not we're going to do it every day forever, just we're going to do it again tomorrow. And tomorrow comes, they don't do it. Don't worry, because there's always another chance tomorrow. This presentation is brought to you by Tomorrow, where you get to do your actions better and good again. So, takeaway number 3, kids who are neurodiverse, they need more accountability, not less. Don't let someone throw a chair at you because you know that they struggle with their behavior. Kids need accountability, they need structure, they need support, and kids who are struggling to regulate need your help to help regulate. So don't leave thinking that anybody should get a free pass. Kids need to be worked with in different ways based on who that kid is, but everybody needs accountability and structure. Here's a few other things that I do as an adult that I think are really helpful for kids as well. First one is visual cues. I think oftentimes visual cues can be more effective than auditory cues. This is the sign that I have on my door, and there's a very specific purpose for it other than telling people where I'm at in the building. As a teacher, I was always terrible with like things that required daily maintenance, like people who change the calendar every day. You all are superheroes in my book. I could never manage to hang on. So like my calendar was always 3 weeks behind, and even just like on a dry erase board, I couldn't quite do it. I don't know what it was about the calendar, but I found this system that really worked for me. And here's what works about it is it's on my door. And so every time I get to the door, it is staring me in the face. And so it takes a half a second to change it for me. And so this thing I'm able to keep up to date because every time I walk in, there is a cue and a prompt staring me in the face, reminding me to do it. So even then, there's days where I forget, I'm in a meeting and I forget to change it, but little visual cues, little things like that, where the student is prompted in a way where they can't miss it, can be really impactful. So if there's a procedure that you really want kids to work on, a behavior that you really want them to keep thinking about, make some kind of visual cue for them. I remember talking with parents a few weeks ago where they said, well, we tell Johnny to go upstairs and do these 5 things and he always forgets what they are. And he does 2 of them. And I said, well, next time, provide him like some kind of visual reminder. If my wife asked me to do 5 things, I would probably remember what 2 of them are. So she writes them down for me. And I always remember what all of them are. And that visual cue, that prompt is enough for me to kind of build up some motivation and some accountability. Next thing I do is the Pomodoro. The Pomodoro is just like, this is, I think, really effective for your older students. For younger kids, I would probably shorten the times. But you do 25 minutes of active work. You are working on the thing that you're supposed to be working on, and then you take a 5-minute break. And you kind of divvy up your activities based on how many Pomodoros you think it would take. So this paper is going to take me 3 Pomodoros to write it. So I'm going to take 25 minutes, take a 5-minute break. And my 4th one is going to be a long rest. I'm going to take 20 minutes to take a break and focus. I know we're almost at our time, and I promise to have you out here right at 5:30. The next one is sensory diets. This is not a classroom I walked in, so I apologize if this actually is your room. I highly doubt it. But there's so much going on. It looks wonderful. Someone like put a lot of work into this, and I appreciate them for it. But a lot of kids are overwhelmed by the number of visual things happening in a room. And they may not even tell you that they're overwhelmed by it, but there's so much happening. Like I see people even like squinting, staring at all the things going on in here. And so think about sometimes less is more. Sometimes a room with 2 or 3 great posters will do just fine. But think about, is your room overflowing with decorations and things like that to a point where maybe it's distracting? I don't know. Maybe it could be, could not be, but that's something to consider. And this is my last takeaway before we part ways here. As I tell everybody, this teaching is rough. There's no joke. Teaching can be tough sometimes. So do what you can with what you have. Capture the little victories when you can. And just always do your best. And if your best is 10%, we'll take it. I have some links that we'll drop in the chat here, one for this presentation. The other one is I made this massive resource list of all things related to working with students with ADHD, places to get more information, strategies to use that are much more well thought out than my rambling. And definitely feel free to email me if you have questions, you want to talk through specific students. I know I cut in, Michael, I know I cut into our Q&A time. So please feel free to email us with questions and we're happy to work with you. But everybody, thank you so much for your time and attention. It's 5:30 on the dot. So we will see you all tomorrow.
Thank you, Zach. And I just want to add, I neglected to mention in the beginning, but the library catalog to the June Harris Memorial Library, which does have, it is a CES, it does have a number of volumes on ADHD. I spent a good amount of time digitizing the whole thing. So the link on the SMORE newsletter that links to the catalog, it is searchable and again, free to lend. So you can reach out to me as well. If you'd like to avail yourself of any of those library resources. Thank you very much, everyone, for attending.
Yep, and I just dropped the links in the chat, so you can add them to your Google Drive and look at them tomorrow after you've had some chance to think about it.
Thank you. Have a good one.
Thanks.